Thank you, Mr. Chairman. I appreciate you hosting this today. So important. Thank you to you, Dr. Cohen, for appearing before the committee. Without a doubt, public confidence in the CDC has been tremendously damaged by the actions of multiple directives, directors, and choices made within CDC leadership. For example, at one point in time, CDC Director Redfield said that masks could offer more protection than vaccines. And of course, we now have scientific evidence that proves masks do very little to prevent transmission of COVID-19. And certainly we can dive into vaccine efficacy issues and questionable studies that were used to justify draconian lockdowns. But it's clear that the CDC has a very long road ahead to reestablish credibility and regain the trust of the American people. And I'm hopeful that your answers today will determine if you are in fact serious about taking on that challenge. Mr. Chairman, for the record, I would ask unanimous consent to submit a statistical numerical errors made by the U.S. Centers for Disease Control and Prevention during COVID-19 pandemic.
Gentlelady's requested a document to be recorded into the record.
Yes, sir.
Is there any objection to her document? I believe that's one that was presented to you all a few 20, 30 minutes ago. Okay, hearing no objection.
Okay. I appreciate it. Thank you. Dr. Cohen, your predecessor, Dr. Walensky, overruled the CDC's own external scientific advisory committees regarding vaccine recommendations. Now, at times, she even refused to convene the external advisory group at all. So one of the most glaring examples of this was when the CDC director, Walensky, pushed through for a third vaccine shot, a booster, for healthcare workers. This recommendation was rejected by CDC's advisory group, and in response, she overruled the advisory council, moved forward with her own recommendation for a third shot. My question to you, Dr. Cohen, is this: have you convened the external advisory committee since assuming this role?
Yes, ma'am.
Okay, perfect. With that being said, there has been $250 million on top of the $8.75 billion spent in COVID promotion, marketing, et cetera, from the CDC for this. Sometimes those external advisory councils give recommendations that are contrary to the administration's political agenda. Have you adopted any of the external committee's recommendations, or have you gone against those recommendations?
Well, thank you so much. Under my tenure, I believe you're referring to our external
Yes.
ACIP committee. Yes, they've met a number of times. We actually have new vaccines for the first time in history, so they had to meet for that. They met for the updated COVID vaccine, the RSV vaccine, and all made recommendations for the vaccines that we then adopted.
So certainly there have been some troubling things coming out in recent years, particularly at the height of the pandemic, where members of that external advisory committee were fired for presenting an opinion that was contrary to the political agenda of the White House. In a situation where one of your advisory members presents a divergent opinion, are you taking that into consideration, or are you simply firing these people?
So I'm not familiar with a situation where folks were fired. The way the ACIP works, they have a certain tenure, they serve for that tenure, and they do roll off, and we do choose additional new members. And we appreciate, that these independent advisory committees advise CDC on this work, and I think they're an important component of how we're reviewing vaccines and our recommendations.
Okay, I was actually referencing Dr. Martin Kulldorff. He was let go, and this was very recent, again, at the height of the pandemic, and I think that there should be a formal review of how that all transpired, because I think that has a direct impact on the guidance that then becomes issued in public from the CDC. At this time, I'd like you to take a look at the screen for me. There is a screenshot. We have here a sampling of dozens of errors within the data that the CDC was using to justify their positions during the pandemic. These errors excessively exaggerated the COVID risk to children, for example. One of the most damning errors was that the CDC repeated for over a month that COVID was a top 5 cause of death for children. It took months for the CDC to correct this statistical error. Now, during the course of those months, millions of taxpayer dollars were spent to promote the vaccine for children just because a basic data point was incorrect. Now, how do you plan to rectify this? Because quite frankly, if the CDC can't get basic data points correct, the credibility will never be restored within this institution. And also, children who really, there was no scientific justification for them receiving the vaccine could potentially, and we have seen documented cases where they have vaccine injuries as a result of that being pushed on them and their parents feeling pressure from the CDC. So can you speak to these errors and how you plan to address these basic errors that have been documented over the past 3 years?
Well, Congressman, I appreciate this, the first time I'm seeing, so let me review and we can follow up. But what I would say is 1,700 kids have died of COVID. But let me tell you what I have done for my own daughters who are 9 and 11. I got them the original COVID vaccines, and just a few weeks ago they got the updated COVID vaccine. It's because I've looked at the data, and I think that these are vaccines that the safety profile is there in terms of safety, and they are very effective at making sure that our kids are protected. I don't want them to either get into the hospital, nor do I want them to get long COVID. So I got my own kids vaccinated, and so I'm happy to look at this data, but I wanted to at least share how I made a decision as a mom for my own kids.
Well, and I know my time has expired, but I would love to have in writing from you a detail of the threat that COVID presents to children and young adults under the age of 18. I'm sure you probably have that off the top of your head if you can provide us that number.
You can get that to us later. I appreciate it. The gentlelady's time is up now. I recognize Ms. Miller Meeks of Iowa.